Slowly the queue moves forward, each patient waiting to go through the doors. Medical practitioners at Mombasa's Bomu Hospital have seen the number of patients rise in the last week, since the week of healing began. This, the time of the year when Roundtable number 3 brings volunteer medics from across the country to operate on needy patients. This year, 4 Belgian doctors joined the team of a total of 31 surgeons, all tackling cases that have been pending, some for years. 36-year-old Christine was diagnosed with fibroids years ago. The doctor recommended an operation, but she chose to take a different route.
So mimi nikaenda kwa herbal, hizi herbal doctors. Wakanipatia dawa so kidogo karegulate ile menses zangu, nikasikia niko poa.
Herbal medicine did not work for long, and when the doctors came to town, she, together with over 500 others, sought their intervention. 23-year-old Charles Ondiek waited over a year after he was told he had a hernia and needed an operation.
Nilishaikuja hapa nikaja nikaambiwa 80,000 nikaona itakuwa zito sana. Ndo nikangojea hivi nikaa naendelea kutafuta polepole na familia yangu. Lakini juzi nikasikia habari ya ofa ndo nikajileta ndo sasa nimesaidika.
These just two in a sea of Kenyans struggling to meet the cost of healthcare without the benefit of health insurance.
Many Kenyans do not fully understand the saying, your health is your wealth, until they fall gravely ill and have to undergo surgeries which are financially draining.
And we have 450,000 Kenyans who die every year from all manner of diseases. And our major concern is that there is no way we are able to address poverty in Kenya unless we address the issue of affordability of healthcare. A lot of Kenyans are spending, for a long time they've been spending their own incomes and resources as when they access care, and therefore driving many Kenyans to poverty.
In the last 4 days, over 200 people have been operated on at the hospital. The numbers of those in need so overwhelming, Roundtable number 3, the group which organizes the event, is now considering doing it twice every year. But even with help from volunteers, it is a costly venture.
And every case you just have to look at, I mean, we want to help them all, but it's just impossible, the lack of funds. We don't have the funds ourselves.
The queue continues to move slowly, but the patients in it do not make a fuss. They don't mind the wait if it eventually gets them through the door. Wilkis Nyabo, Citizen Weekend.